This Mind and Muscle segment is brought to you by Beacon Orthopedics and Sports Medicine.
Time again for Mind and Muscle, Beacon Orthopedics and Sports Medicine. We have Dr. Haleem Chaudhary with us, and we're talking knee replacements. And maybe a knee replacement isn't as big of a deal as it sounds. Exactly what do you do with this?
Well, knee replacements have made a lot of advancements in the last 4 or 5 years. We're doing them outpatient. Patients get to recover in the comfort of their own home.
And with this model here, exactly what do you replace in that knee?
Well, people think we're taking the whole knee out and putting one in. It's not like that. We're keeping a lot of the knee, and the actual bone resection is very small. We resurface the knee with a metal implant, and we don't take out a lot of bone to do it. With our current pain management techniques, we can get people home and have a quick recovery.
And to do this using outpatient surgery, I got to think that helps with the price tag and everything else.
Outpatient knee replacements, it's cheaper, it's more convenient. Patients have less pain and they get to recover in their own home.
Who are the prime candidates to be an outpatient for knee replacement?
Well, younger patients, patients who are healthy, patients who want to recover fast, go-getters, and don't have a lot of medical complications are perfect for outpatient knee replacement.
Boy, it's come a long way. Dr. Chaudhary, thank you very much. That's it for this week's Mind and Muscle.
Schedule your appointment 24 hours a day at 513-530-3333 or online at beaconortho.com.